So what, give us the bear case.
Yeah.
What should we be concerned with? What should we be at least looking out for?
Yeah. I would say overall at the present time, I would consider these drugs to be quite safe. The major issue is you have to go slow because of the GI toxicity. Where is the controversy involved? And it's something that I'm involved with myself. When you lose 20 or 30% of your body weight, you lose muscle mass, okay? Now, I just gave a talk on this to one of the pharmaceutical companies that are involved in this area. I'm not going to name the name of the pharmaceutical company, but I started off by saying, look, here's now a study with real data. This is a gastric bypass surgery study, Roux-en-Y bypass, and the people lost, I think it was 33% of their body weight. And their lean body mass came down quite significantly. One of the problems is people measure lean body mass, and that's not a real measure of muscle mass. In fact, it can be a very bad measure. You should measure muscle mass. But let's assume that the lean body mass largely reflects, it's a reasonable assumption, muscle mass. So muscle mass came down, okay? So why is that so bad?
But how much did it come down? Because if your total body mass came down by 33%,
Yep.
but 3/4 of that mass was fat,
Yeah.
and only 1/4 of that was lean, we would consider that acceptable.
And this is where the controversy is.
Yeah.
Because no one has really measured muscle mass.
That's right.
We're doing it, okay?
Okay.
We will have a definitive answer.
And you're doing that with MR?
MRI.
Yep.
Yeah. Okay. So it's gold standard.
Yep.
Okay. But now I said, look, in this study, they measured absolute strength. You can do grip strength or leg strength. And absolute strength went down a little bit. Okay. Maybe 25%.
Were these patients exercising during the period of weight loss?
No.
Okay.
No. Then they said, let's express strength
As a
for weight loss.
For weight, yeah.
Whew, up by 50%. Per appendicular,
Yeah.
it goes up by 50%. And then they said, how far can they walk? They went from walking 200 yards to 2 miles. And then said, one of the things is how many times can you get up out of a chair in a certain period of time? It increased like 3 or 4-fold. And they measured your VO2 max.
Yeah, of course, which is heavily dependent on weight as well.
Yeah, it all got better.
But in absolute terms, did VO2 max get better? Not necessarily.
Yeah.
The total VO2, not
everything,
normalized per kilogram.
No, everything got better.
Okay.
So I said, so why you guys...
That's counterintuitive, by the way.
Yeah.
Normally when you lose weight,
yeah.
VO2 max in liters per minute does not improve because you have less metabolic tissue.
Right. But here, for whatever the reasons are, maybe all of the fat that's pushing on your lungs so you can't oxygenate, the epicardial fat that's not allowing your heart to contract, the fat that's in the heart that's causing myocardial lipotoxicity, which I believe is real. These things are all changing in a positive way. So again, it's a balance of... Yeah. So, of course, they don't like this because... If the people, and they had all kinds of psychological questionnaires.
Wait, why weren't they happy with these results?
Well, because now the companies are all looking at developing drugs that will preserve the muscle mass or increase the muscle mass. But basically what I'm saying is that, look, there's a huge, it's lean body mass, but we have to say it's reflecting muscle mass. Everything gets better. The patient feels better, they can walk better, they feel stronger, et cetera, et cetera. Why are you so worried about muscle mass? Like, I look all these gloomy faces because they're all developing myostatin inhibitors or event. And so then the next slide comes up and says, retort. Here's a good thing, okay? So now, if you lose all of this body weight and you improve insulin sensitivity in muscle, and you improve it in the heart, and there are cardiovascular benefits, and you correct the improvement in all of the cardiovascular risk factors, now, even though you've lost muscle mass, if you've improved insulin sensitivity, there may be an enormous benefit of seeing the improvement in the muscle insulin sensitivity, even though you've lost muscle mass. And they do have some concerns about these drugs, these myostatin inhibitors, that actually may have some negative effects on the heart. And my suggestion is actually you may find a big improvement in myocardial function from these.